While Direction Service values leaders who see barriers and work to systematically dismantle them. This is the second presentation of the Visionary Leadership Award, presented to a leader who has the courage to hope for a better future, the charisma to capture our attention, the confidence and wisdom to empower others, and the stamina to see their vision fulfilled. The 2019 visionaries were John Reese and Greg Evans for their leadership in establishing the 15th Night movement. With her collaborative, innovative, and tenacious spirit, intellect, and deep compassion, it is no surprise that we at Direction Service would like to honor Dr. Pilar Bradshaw as one of these leaders. As a freshly minted family service coordinator, I quickly discovered that within our community exists a thoughtfully woven safety net made up of an intricate web of systems, organizations, and providers. Families must navigate this complex web in order to meet their needs. As I was invited into the lives and homes of hundreds of families, I quickly discovered there were individuals within this web that were making a real and meaningful difference for these families over and over again. This was when I first learned of the compassionate and quality care that Dr. Bradshaw was providing in our community as a pediatrician. Her commitment to going above and beyond for her patients was immediately noticeable. From providing critical connections and supports to families to running support groups in her lobby, she either found or created ways for families to meet their needs. In addition to all the ways Dr. Bradshaw leads our community, her visionary leadership in bringing about the integration of physical and behavioral health within her own practice is remarkable. As I just described, she's nothing if not responsive to the needs of our community. She also employs her talents and charisma to build relationships to do this work. As an example, when our community was rocked by several deaths of youth by suicide, Dr. Bradshaw levered her relationships and reputation and brought together a staggering number of government officials, educators, nonprofit leaders, etc., for a suicide prevention summit. Using her own resources to fund this event and even the ongoing work in this area. Here at Direction Service, we regularly see the direct impact of her work. Dr. Bradshaw's leadership changes lives. Because of this visionary thinking and dedication, we wish to present Dr. Pilar Bradshaw with the Direction Service Visionary Award.
It's wonderful to be acknowledged this morning by Direction Service, an organization for which I'm extremely grateful. This has been a longstanding pillar in our community of support for differently abled people and their families, and I feel like it has intersected strongly with my work as a pediatrician, so I really want to thank you. I feel like times that we're in now as a nation and as a world really have a way of making you stop and think about where have you been and where are you going? When I came back to my hometown, Eugene, in 1999 to start my career, I knew I wanted to take care of kids. My focus during those early years was to become the strongest clinician I could be, learning from my mentors and learning most of all from my patients. And taking care of so many extraordinary children, watching especially those who struggled to overcome physical and mental barriers that most of us cannot fathom, changed me. I became a better listener, a deeper thinker, a more tender person, and I started to see things that my patients and their families needed. I partnered with a mom in my practice to start a support group for parents of chronically and seriously ill children, and for many years we met monthly in the lobby of my first clinic here. In 2009, when I made the leap to owning a practice of my own, I believed another unmet need was a central place to share information with parents about their children's medical care, growth and development, safety, parenting tips, and current events. So I wrote the content for my website, eugenepeds.com. Since its launch 10 years ago, eugenepeds.com has had well over 1 million visits from 97 countries and every state in the United States. As the years passed, it felt to me like we pediatricians were missing the boat sometimes in how we cared for kids. Sure, we took care of their illnesses, did their vaccines and checkups, and took care of them in the hospital when they were very sick. But we doctors weren't able to help with some of the key issues kids and families faced. So I decided Eugene Pediatrics needed to integrate behavioral health and social work into our practice. We added child psychology, individual and family therapy, social workers, and eventually child psychiatry to work side by side with our medical clinicians. And suddenly it felt like this is what we should have been doing all along. Physicians took care of medical issues, behaviorists took care of behavioral health issues, and social workers were able to address a wide range of social needs of our families. A pinnacle of my career was the visit of Governor Kate Brown in 2017. After touring Eugene Pediatrics and Thrive, meeting the integrated team, and talking to several of our patients, Governor Brown declared, "This is how every primary care clinic should work." And it was through my now wider lens of seeing more of what the social and behavioral health needs were of the community that a new concept surfaced. There was an epidemic unfolding right in front of all of our eyes, an epidemic of depression and suicide in our youth. In a very short period of a few months, 8 beautiful children took their own lives. And it was at one of those evenings that my social worker spouse and I sat together and said, what can we do? What can we do as people, and what can we do as a community? The next morning, we started picking up the phone and calling everyone we knew. We wanted to put the right people together in one place to see what more we could all do as a community to address the startling data. 1 in 3 of our Lane County teens was depressed. 1 in 4 had considered suicide, and 1 in 5, a staggering number, had tried to commit suicide just in the previous year. The Teen Suicide Prevention Summit was a powerful event. In one large room sat nearly 150 school superintendents and teachers, mental health experts, social service agency directors, pediatric health experts, state and local politicians, forming new partnerships and talking about implementing a teen-based, school-based, adult-supervised suicide prevention program. One of the participants in the summit, Superintendent Chris Para, for whom I have the highest level of admiration, ran with the ball, and last year she rolled out Sources of Strength in every middle and high school in the Bethel School District. Eugene Pediatrics funded that first year of Sources of Strength because we believe so deeply in the idea that kids with the right support can change the culture. Which brings me to today, a time when we can all see how much our culture needs to change. It will take all of us working in our fields and across all boundaries. We will all need to think, to listen, to learn, to advocate, to vote for positive change. As I take stock of my own professional and personal future, I think about what can I do as a pediatrician and mother and as a member of our community to help root out racism and to eradicate hatred. The current pandemic also has really laid bare many of the inequalities that exist in our country. Deaths from COVID-19 have disproportionately hit people of color, people who are socially fragile, and the medically fragile. And it's been a grim reminder. Unequal access to good quality medical care really matters. And it shows us we do not yet live in a country where everyone is equal. None of us can rest until we work together to fix that. So I want to thank everyone again this morning at Direction Service for this great honor. I promise to continue to work as a member of our community with everyone else until we can lift up everyone who needs to be heard and who deserves to be celebrated.
We are so grateful to have Dr. Bradshaw working for youth and families in our community. I'm sure you join me in celebrating Dr. Bradshaw for being such a visionary leader.